So watch this.
So how many of these plans are there out there? They sound good.
It really is a lot to get out of one plan. And honestly, Dr. Oz, there's no other option on the market like this for our Medicare beneficiaries. Over 2,000 Medicare Advantage plans are available nationwide. And most of our Medicare beneficiaries do have access to the $0 premium plans, depending on the area that they live in.
I would think if I could get potentially $0 expense for some of the things we just talked about, I'd be signing up. So why are not more folks signed up?
Ignorant or misinformed or just a pitch man. Hi, I'm Christopher Westfall. Today we're going to explore Dr. Oz being nominated for the Center of Medicare and Medicaid Services to run all of Medicare, the biggest budget, except for defense, in the entire country. Is this a good thing? I don't think so. I'm going to share with you a commercial that Dr. Oz did very, very recently, and there are only 5,000 people that watched it because he did it on YouTube. There'll be more people watching it on this program than actually watched it on his own YouTube channel. But it's important that you know what his philosophy is. And so far, it's depended on who's going to pay him. And that's a very bad place to be. I'm going to show you Dr. Oz in its entirety, but also cut away and show behind the scenes things that have been discovered about Medicare Advantage, that even if you're going to be on Medicare Advantage, you need to understand what you're up against. You need to understand how the appeals work, what's denied, what you should not buy a plan based on, and what you should. So I'm going to show you Dr. Oz, and then also cut away, and then also at the very end, show you the very agency that he hopes to lead and what they had to say about Medicare Advantage. This will be fascinating. And then some other updates of what's going on in Medicare. So watch this and share this with somebody on Medicare, please.
My favorite phrase is, and I don't get to say it enough, so I'll do it right now, $0, right? We all want things for less, especially if they can improve our health. So here's a question for all of you. Which of these items can you get for $0? Can you get a cup of coffee for $0? Or a pack of gum? How about a newspaper, which they're both on, right? Not so easy. Or how about a health insurance plan that may include access to wellness programs, to vision, dental, hearing benefits, may even include prescription coverage, right? Which one can you get for $0? Right? If you guess these, you're right, because it's available now for some folks. Believe it or not, it is possible to get health insurance plans now with a $0 monthly premium. Millions of people already are doing it, and so could you. Which is why I'm going to take a few seconds. I want to talk about healthcare today, because I know it can be expensive. I hear it from you all the time. So let me walk you through this a little bit. You only have so much money in your piggy bank, right? It's just only so much there, right? And counseling and gym memberships, right? They can cost a little bit of money. And so these programs can sort of build up. Prescription drugs can cost a lot of money, especially if you have to take more than one. Plus you got dental and vision and hearing coverage, right? And no wonder it feels like your piggy bank just begins to melt away in front of you to almost nothing. But Medicare beneficiaries have another option. With Medicare Advantage, you could get a plan with $0 monthly premium, which could mean lots more money in your piggy bank, which is the goal here. Here to tell us more is 𝗤𝐿ISA Jackson, who's here on behalf of my trusted sponsorship partner, MedicareAdvantage.com. 𝗤𝐿ISA is an experienced, licensed insurance agent who has helped thousands of people learn about their Medicare options, which is why I trust her. So, Medicare Advantage, walk folks through what it is.
Awesome. So a Medicare Advantage plan is an option for our Medicare beneficiaries who are actually looking to expand their coverage. These plans are offered by private insurance companies and provide the exact same coverage as your Medicare Parts A and B.
If a senior has original or traditional Medicare, they can expect to receive up to 100 days of coverage for their stay with no hassle. If a senior has a Medicare Advantage plan, however, they can expect to receive a denial well before their doctors even say they're ready to go home. This is despite the requirement that's been discussed that Advantage plans must offer the same benefits and apply the same coverage criteria as original Medicare. When a patient first receives a denial, they're thrown into a maze of red tape that is dizzying even to our experienced legal team. The initial denial is made not by the Advantage plan, but a third-party contractor using an algorithm. A computer determines what a patient's predicted length of stay should be based on millions of past beneficiary data points, not the patient's plan of care or the advice of their doctors. Then, at each additional level of appeal, if the patient actually chooses to fight it, The denials are upheld by quality improvement organizations with little to no explanation. If a patient is successful with an appeal while still in the facility, they can expect a new round of denials to start in a matter of days. Patients caught in this maze are forced to make a devastating decision: stay in the rehab facility and pay thousands of dollars out of pocket, or go home against medical advice.
However, a lot of these plans do provide you with additional benefits that a lot of people need, such as prescription drug coverage, as you mentioned, the dental, the vision, hearing, and wellness programs. And I found that those are game changers for a lot of people looking to expand their coverage.
To the point of the supplemental benefits, enticing people into taking them, that's the short term. And we all have, short-term goals. It's easy to save money at the beginning and to say, I'm going to get these extra things that original Medicare doesn't cover. That's really, enticing for me to take this plan. There might be a low premium as well. But most of us don't think about the larger problems when they're actually going to need help. And like in Ms. Ben's case, they looked and they saw 100 days of coverage. That's what they expected to need when the time came. And absolutely, I would say it's a bait and switch, because you get to that point when you do actually need those bigger things and you're denied.
So it looks like a good plan as long as all you need is like dental or vision. Everybody needs dental or vision. Nobody plans on melanoma, correct?
Correct, yes.
Or on other kinds of acute rehabilitative or long-term rehabilitative care.
Yes, that's correct.
So how many of these plans are there out there? They sound good.
It really is a lot to get out of one plan. And honestly, Dr. Oz, there's no other option on the market like this for our Medicare beneficiaries. Over 2,000 Medicare Advantage plans are available nationwide. And most of our Medicare beneficiaries do have access to the $0 premium plans, depending on the area that they live in.
I would think if I could get potentially $0 expense for some of the things we just talked about, I'd be signing up. So why are not more folks signed up?
Well, actually, over 20 million people are currently enrolled into a Medicare Advantage plan. So that's a lot of people. However, that's only about a third of our Medicare beneficiaries. So there's still millions of people who can have a Medicare Advantage plan, with less costs, more benefits, if they simply just look into it.
Yeah, can I speak to the audience on this? I bet a lot of folks are sitting at home right now thinking, I'm just not going to think about this right now, right? Seriously. Right. So since this show started, right, almost 10 years ago, enrollment in Medicare Advantage has increased by over 70%. The fact is, everyone around you is signing up, which is why I want you just to focus and see if it makes sense for you. If it doesn't, it's fine. But if it does, stop waiting on the sideline. So how can folks sign up today?
So now is actually the best time to do it, because it's Medicare's open enrollment until December the 7th. And for a lot of people, this is the only time of the year to get a Medicare Advantage plan.
I mean, look, I'm not want to, I want to nudge you. I don't want to shove you, but think about this, because 70% more increase since I started the show means a lot to me. All right, who's got the last question? Take it away.
You said now is a good time to sign up.
What I'm hearing is stop waiting on the sideline. Is that what you're all hearing?
It's the time of the year.
Take a moment, think about it, decide now. So, MedicareAdvantage.com has set up a special phone number for Oz viewers who want to speak with a licensed insurance agent about Medicare Advantage. So give them a call today, learn about your options, see what works for you. They're available to answer all your questions. Did I miss anything with the viewers?
You did great.
Oh, good. I got a good grade, got passing grade from the insurance agent. We'll be right back.
Are you or a loved one enrolled in Medicare Advantage or Medicaid Managed Care? This is a service model called Managed Care, and millions of Americans and Medicare and Medicaid stand to benefit if Managed Care achieves its promise to deliver high-quality care more efficiently. It's important to understand the basics of Managed Care and how it may affect you. What is Managed Care? Managed Care is a healthcare delivery model and an alternative way Medicare and Medicaid patients can get their health benefits. In traditional Medicare and Medicaid, the government covers healthcare for seniors, individuals with disabilities, and others by paying healthcare providers that care for Medicare and Medicaid patients. In Managed Care, the government pays private health insurance plans to provide coverage for Medicare and Medicaid patients, and the plans pay healthcare providers that care for the patients enrolled in their plan. The government pays an insurance plan a fixed monthly payment to provide you coverage for healthcare benefits. In exchange, plans get to keep that full payment regardless of how much healthcare you need each month. If you need a lot of services in a month, the plan must cover those costs, even if it costs more than the fixed monthly payment they receive. Or, if you don't need very many services, the plan gets to keep the difference between the payment it got and the cost of those services. One concern is that when plans agree to cover the cost of your care for a fixed monthly payment, some plans might improperly limit your access to care to maximize their profits. If you get less healthcare services, the plan gets to keep a larger share of the fixed monthly payment. OIG work has found that some plans inappropriately deny authorizations for services or deny payments for services. This is called stinting on care, and these inappropriate denials can interfere with your timely access to necessary healthcare services. Also, Medicare will increase the fixed monthly payment when plans provide coverage for enrollees who may be sicker than expected. These are called risk adjustment payments and are designed to make sure Medicare Advantage plans are paid appropriately based on the health status of enrollees who may need a little more care due to significant health conditions. Some Medicaid programs make similar payment adjustments. One of the well-known concerns associated with Medicare Advantage is the potential to game the risk adjustment payment program. Some insurance plans may inappropriately receive more money than they should because they overstate how sick their members are. In some cases, plans may offer you a free health risk assessment and then use that assessment to make you appear sicker than you are, or diagnose you with conditions that you don't have or haven't received treatment for. So what can you do to protect yourself if you're enrolled in Medicare Advantage or Medicaid Managed Care? First, be informed. Read your plan's materials carefully and understand what is covered. For example, the Centers for Medicare and Medicaid Services publishes information to help enrollees understand the differences between being enrolled with a Medicare Advantage plan versus enrolling in traditional Medicare. Many states make similar information available about their Medicaid Managed Care programs. Second, don't hesitate to ask questions. If you feel like you're not getting the care you need, talk to your healthcare provider or call the Enrollee Assistance Line for your Medicare or Medicaid health insurance plan. Third, if you suspect your plan is stinting on care or not providing the services it promised, please report your concerns to Medicare or your state Medicaid agency. Finally, stay informed about changes in your plan. Plans can change each year, so review the annual materials for your plan closely. The American people deserve to know that the insurance companies receiving more than $700 billion annually in taxpayer funds are working to ensure you receive effective, high-quality care. Remember, you have rights and options to ensure you receive the care you deserve.
So why do you think that the federal government is putting out warnings about Medicare Advantage, and yet this guy will say anything that they want him to say? It's just amazing because it's zero premium. If zero premium is the only moniker by which you judge a healthcare plan, you need a lot more education about the healthcare plans that are out there. As a matter of fact, Dr. Oz has literally proposed that Medicare Advantage should replace all healthcare, including the Affordable Care Act and employer insurance. And as you can see here, his video only got 5,000 views. So apparently not too many people are interested in this. And also, it's also important to know that, and it's great that you have investments in different places, but he has a lot of money invested in actually the companies that deliver Medicare Advantage. Let me share this part with you. Oz recently held investments, some shared with family and healthcare, pharmaceutical firms, and tech companies with business in the healthcare sector, such as Amazon. Collectively, Oz's holdings totaled tens of millions of dollars, according to his financial disclosures that he did during the Senate race, including a stake in United Health Group worth $600,000. It's not clear if Oz, a heart surgeon by training, still holds investments in healthcare companies or if he would divest his shares, but there's no reason to have to do so. And they asked his staff about it. They declined to answer. It's obvious, NPR story says, that over the years, he's cultivated an interest in the pharmaceutical industry and the insurance industry. Interesting. That raises a question of whether he can be trusted to act on behalf of the American people, they said. So, yeah, it just, and CVS and Cigna and others that are big in the Medicare Advantage space, he proposes Medicare Advantage. I'm telling you, you really have to stay up to date. Things change all the time with regard to Medicare, and what's proposed, people even who lead it can make a huge difference in the quality of care that you can get Medicare Advantage enrollment has spiked. And it sounds so good when you're turning 65, especially when 90% of the agents that you meet with are not going to say anything other than, yeah, you should do this Medicare Advantage. Here's how it works. It's free. You just sign right here and you get all these benefits. And that's why people are signing up for it. And the Senate hearings revealed that it's great for the small stuff until you get the big stuff. And it's considered by Medicare and the Congressional Budget Office that up to 64% of people that are brand new to Medicare will be joining Medicare Advantage. Great. There's some updates to do in Medicare. I'll catch that with you in the next video. Just wanted you to know in a timely fashion what's up with Dr. Oz possibly running Medicare. I don't think it's a good thing. Matter of fact, I think it'd be very detrimental to the people that are still on original Medicare, because one person opined that he will probably make Medicare Advantage the primary default choice of people turning 65. Hopefully that won't happen. We're going to stay here and advocate for you and continue to bring you news on Medicare. Don't miss the next live broadcast. We'll talk to you soon. Thanks for being here. Bye-bye.